Pain sucks, but what sucks even more is when no one can explain why you're having pain. Making things worse is receiving ineffective treatments that leave you feeling like nothing can be done. And just ask yourself, has anyone actually sat down and explained why you have pain? And I'm not talking about someone reading off your X-ray or MRI report. I'm talking about really discussing what pain is and how it works, because the key to treating pain is understanding it. Once you know what you're dealing with, the pain won't seem so scary anymore, and you'll be able to take the necessary steps to manage your symptoms without depending on anyone else. In this video, we'll help you put a name to your pain so you can start taking control. The first thing to understand is that pain is 100% experienced in your brain, not at the location of symptoms. When the body encounters a stimulus, sensory nerves send signals to the spinal cord, which then transmits those signals to the brain for interpretation. The brain then processes this information, and a pain response is elicited. So without the brain, there is no pain. Our sensory experience is the result of an immensely complex orchestra of neural networks that involves the interaction of various regions of the brain and spinal cord. This interaction influences how pain is processed and shapes our perception of our body and the environment around us. And conducting it all is the sensory cortex, which is the region of the brain that plays a crucial role in processing sensory information from the body. The sensory cortex allows us to identify the location, intensity, and quality of sensory information, allowing us to perceive not only pain, but also touch, temperature, pressure, and other sensory experiences. Even the most basic organisms with a neural network possess the ability to sense and respond to the environment around them. However, what sets humans apart is our emotions and cognition. Located in the inner regions of the brain is the limbic system, which regulates the emotional responses to different experiences. Emotions can either amplify or dampen the sensory orchestra, like the volume dial on a radio. When pain makes you afraid or anxious, that dial turns up, increasing the reactivity of your nervous system and then perception of pain. And when you're relaxed and calm, the dial turns down, reducing the reactivity of the nervous system, and pain is less intense. Along with our emotions, our previous experiences, beliefs, and expectations also alter the way we process pain. As you can see, pain is an incredibly individualized experience that is influenced by a complex interaction of sensory input, emotions, as well as beliefs and past experiences. Now, there are three main types of pain, each classified based on how the pain is generated and then processed in the brain. Nociceptors are specialized sensors located in different tissues of the body, such as the skin, muscles, tendons, bones, and organs. These sensors are responsible for detecting and responding to potentially harmful events. Think of these as the smoke detectors of your house. Just like how smoke detectors are set off by smoke from a fire, nociceptors are triggered by irritating stimuli, such as stubbing your toe on a coffee table, swelling from arthritis, or burning the roof of your mouth on mashed potatoes that are the temperature of lava. Nociceptive pain is typically described as sharp, throbbing, or aching. The pain is often local, although there can be times where the pain travels from the site of actual tissue injury. A common example of this is when low back pain spreads into the butt or thigh. This occurs because sensory nerves that carry pain signals from the irritated area catch a ride on the nerves that serve different areas of the body, causing the brain to perceive pain as coming from a different location. The initial treatment strategy for managing nociceptive pain focuses on managing inflammation and then restoring the tissue's tolerance to activity. This is done through a combination of pain-relieving and anti-inflammatory medications, as well as physical therapy. Physical therapists utilize a variety of techniques, including massage, joint manipulation, and trigger point dry needling, while also incorporating exercises to promote tissue healing and tolerance to movement. Once sufficient healing has been achieved, a progressive conditioning program is then introduced to regain tissue strength and reduce the risk of re-injury. In cases where pain is limiting participation in therapy, cortisone injections may be indicated. And if the local tissue injury is too extensive, such as in cases of tendon or ligament tearing or severe arthritis, surgical management may be required. Neuropathic pain is different from nociceptive pain because it serves no beneficial purpose in the body's healing process. It is caused by injury or disease of the nervous system, causing the sensory pathways to become hyperexcitable, increasing their sensitivity to temperature, movement, pressure, and inflammation. Common conditions associated with neuropathic pain include lumbar stenosis, sciatica, and carpal tunnel. Neuropathic pain is a type of pain that can feel like electric shocks, burning, and shooting sensations. This pain is usually felt in specific areas of the body, following in the path of the affected nerve. Other neurologic symptoms, such as numbness, weakness, or tingling, may also be present. Nerve pain can be quite intense, more easily provoked, and take longer to settle compared to nociceptive pain. Management of neuropathic pain typically involves a combination of medication and conservative interventions, including physical therapy. Some of the medications used to treat neuropathic pain include antidepressants and anticonvulsives. Although these medications are used to manage mental and seizure disorders, they also can be effective at inhibiting pain processing or blocking chemicals that set off pain signals. While opioids are often used to treat nociceptive pain in severe cases, they are generally less effective for neuropathic pain. In cases of severe nerve conditions that are unresponsive to therapy, nerve block injections can be utilized for pain control. Early physical therapy treatment of neuropathic pain focuses on education on how to reduce stress through the area with daily activities, while providing treatment to reduce tension and compression through the involved nerve. This can be done with similar treatments utilized for nociceptive pain, including soft tissue massage, joint manipulation, and dry needling, while also a combination of nerve-specific exercises to improve the mobility and health of the neural tissue. Once pain is better controlled, progressive loading strategies are then introduced to improve tolerance to movement and forces of daily life. In the event where nerve injury is progressively worsening or is unresponsive to physical therapy, surgical management may be required to decompress the nerve and prevent long-term damage. Nociplastic pain is a type of pain that arises despite no clear evidence of tissue injury or persists after an injury that is fully healed. Hyperexcitability of the central nervous system, termed central sensitization, is thought to be a key underlying mechanism of nociplastic pain. It occurs due to changes in the way that the brain and spinal cord process pain signals, leading to increased sensitivity and amplification of pain. Unlike nociceptive pain, which requires a specific level of stimulation to trigger symptoms, individuals with nociplastic pain can experience pain without a physical stimulus. Using imaging studies, researchers have shown activation in pain-related brain regions and decreased activation in regions involved in pain inhibition and regulation in those with nociplastic pain. There is also an increase in activation of the emotional centers of the brain, suggesting that emotional and cognitive factors play a significant role in the development and maintenance of nociplastic pain. So yeah, it's all in your head, but not in the make-believe sense, more in the neurophysiologic sense. Nociplastic pain is commonly characterized by widespread, disproportionate, and unpredictable pain symptoms, often accompanied by an increased sensitivity to temperature and movement. And due to the strong association between pain symptoms, cognition, and emotions, those who have a history of depression or anxiety, post-traumatic stress, have poor coping abilities, or a heightened fear of activity are more likely to develop nociplastic pain. Treatment for nociplastic pain requires a multimodal treatment approach, including cognitive behavioral therapy, physical therapy, medication management, and mindfulness-based strategies. The goal of this approach is to address the physical, emotional, and cognitive aspects of the pain experience. Treatment may involve identifying and modifying negative thought patterns, improving sleep hygiene, utilizing medications to manage pain and other contributing conditions, and incorporating relaxation and stress reduction techniques. A focus on patient education and empowerment is also critical to help individuals better understand their pain and take an active role in their own care and reduce dependency on the medical system. Ultimately, treatment of nociplastic pain is about managing pain, not curing it. To recap, pain is a complex and individualized experience that goes well beyond what is seen on an X-ray or MRI report. Understanding pain and how it works is the first step in taking control of your symptoms. By identifying the type of pain you're experiencing and contributing factors, you can develop an effective treatment plan that is right for you. So remember, pain does not have to control you. With the right knowledge and tools, you can take control and manage your symptoms and go on living a full and active life. Well, I hope you enjoyed this episode of Physio Show. Make sure you like and subscribe to the channel to help us grow and continue to provide you with quality physical therapy related content.